Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'm leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy, all the way from Lagos, Nigeria. Dr. Murphy, how are you doing today?
Um, Very well, thank you. Nice and warm here.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your public health, COVID, or infectious disease questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines, a viewer submitted question, and our lone US COVID statistic through today, March 28th. We invite you to submit any questions or suggested topics down below in the comments or via any of our social media linked in the description. Starting with those COVID numbers, average COVID deaths per day in the last reported week were down to 59. In the same week in 2024, we saw 181. Dr. Murphy, reactions to those numbers and the state of COVID in the US?
Yeah, as predicted, this is what happens in March, April of the winter flu respiratory season. So we're getting down kind of to a dull roar. Wastewater measurements have been in the low to moderate range. It's still out there. You can still get COVID. Don't worry about that. But it's going down. The good thing is that the deaths have gone way down compared to last year, and we hope that continues, in the next few years as well. But right now, it's still a problem.
Mhm. And while we're on the topic of COVID, there was a big story this week about federal funding for COVID research being cut or dramatically reduced. Can you share those numbers with us? And also, what are the practical effects of this?
Well, the practical effects, yes, the pandemic is over, but the disease hasn't gone away, as we just were talking about. But this COVID funding decrease is really having a huge impact on state health departments. Illinois, in particular, the director of the Illinois Department of Public Health released a statement yesterday, saying how devastating these cuts. These funds have actually been approved by a bipartisan Congress, and were being spent to prepare us not only for the COVID pandemic, for the next pandemics. They've been used even to fight the measles cases that are going on. And that is just all coming to a screeching halt. Other research, like in new drugs for COVID, and the drugs for COVID can be used for other diseases as well. So including emerging infectious diseases. They had one commitment of $577 million that was just halted. So these are all very short-sighted, quote, savings that is really not good for the health of the country.
That could have bigger consequences when we need those things in the future.
Right. Exactly.
Now, the latest update we have on the Texas, New Mexico surrounding area measles outbreak continues to update. There should be more updates from local health departments later today, but as of now, can you tell us where we are?
Well, a couple things is now Kansas has just joined the group of states where this measles outbreak is coming. So the patients in Texas, and then New Mexico, then Oklahoma, and now Kansas. Kansas is just part of the deal now. They're up to 327 cases. This is one of the biggest epidemics of measles in a long time. The good news is that the vaccine uptake in Texas and New Mexico in particular has increased. So, they are getting out there, they're vaccinating those people that need to be vaccinated. And that's the only thing that's going to stop this. Otherwise, it's not going to stop. It will just continue, it'll smolder. It'll be like, instead of reporting COVID every day, we'll be reporting about measles. Remember, somewhere between 1 in 1,000 and 1 in 10,000 people die from measles. We've already had several deaths from measles. And they're all preventable. And these other treatments like vitamin A and all this other stuff that are being talked about are going to do nothing to impact this epidemic. So measles is that's the status of measles right now.
hmm And bringing it back to those billions of dollars of COVID funding, those are the funds that are being used by local health departments to supply these vaccines, get people out there, et cetera. So very
Right.
important stuff.
Public health is very different than your individual health. When you get sick, you go to the doctor. But when something is infecting like everybody in the community, one doctor can't do it, or not everyone can go to the same doctor or a doctor at all. It really takes a public health effort. And that's what's being cut back.
Mhm. And speaking of public health efforts, the avian flu has been our other long running public health story. We have a submitted question today from a longtime viewer who asks, in rural areas, is it a concern that water runoff from farms with infections could get into nearby lakes or water supplies? Do you sense that there's any risk of bird flu in water supplies?
Yeah, this is a really great question, and fortunately, we have a positive answer, and that so far there has been no environmental transmission of avian flu, bird flu. Okay, none. We don't even have transmission documented from person to person. So it's all coming from uh, uh, the sick infected animals to the people that are working with those animals, or for some reason come in contact with them. It's mostly birds. But now we've even found out that sheep can be infected. So we have a seal at the Lincoln Park Zoo. We have sheep. Cats have been reported. All sorts of other animals, and that's the status right there.
Yeah. So on that note, your drinking water should be fine. But while
Right.
we're talking about all these animals, can you give us an update on the birds and herds and a global look at the avian flu?
It's been absolutely devastating for the commercial bird farmers and dairy cattle farmers. 168 million birds have been culled, including the 3,000 or so in Madison, Illinois, at the little farm down there. But 994 cattle herds have been infected. The 70 people have been infected. In Cambodia, they've only reported 3 cases. All of them died. All 3 died. So remember, this is the part of the world where originally um, avian flu was reported in the last 10 years, and 50% of the people died. It was about a little under 1,000, like 900 something, and half of those people died. That's why everyone is so nervous. Like, why are so many people dying of avian flu, particularly in this region? We don't know. We don't know if it's a different strain of virus or whatever, but it's something that really needs to be known. But that's why everyone's so hot about avian flu. And if it ever starts to be able to be transmitted human to human, it's a completely different ballgame. And that is totally possible at some point.
Absolutely.
Not happening today, but it's a theoretic possibility at this point.
Yeah, that's the big alarm bell we are looking out for and hoping does not come to pass. But what has come to pass in recent months are continued funding cuts for different global agencies, this time for GAVI. Can you tell us what GAVI is and what these funding changes mean?
Yeah, GAVI is a huge NGO that supplies vaccines for life-threatening diseases, mostly impacting children. It includes measles vaccines, but other vaccines as well, the whole package of vaccines, and they have really been cut off. And this is like something like $2.6 billion has been cut in their funding. Now they have other funding sources, and like we've said before, if you're going to phase out of a program, you can do that safely if it's done over 1 to 3 years or something. We're talking about a massive thing. This is like stuff that's overnight. Terminate. Stop completely. Don't do any more work on these projects. NGOs have closed. Thousands of healthcare workers have been fired. I'm in Africa right now. I mean, it's a disaster on this level to hear really what's going on. The predictions that WHO has is that this is going to result in, if we throw in the HIV treatments and everything in the same thing as vaccines, 2,000 new HIV diagnosis per day. Per day. That's over 700,000 per year. Once you get HIV, you have it forever. And if you're not treated, you die. So it's not like COVID where, people get sick and then they get better, most of them. HIV, people get sick with it and they die from it in 6 to 10 years if they're not treated. So it's devastating. We were just so close to starting to see a downturn in the number of new AIDS, HIV cases, and that's over now. We're going to see millions of more cases, and we're going to have millions of more deaths over the next 4 to 5 years. It's just really, really actually unfortunate. You know, the whole PEPFAR program, the President's Emergency Plan for AIDS Relief, sort of part of this whole thing we're talking about, you know, these giant programs, you know, was hugely successful and saved tens of millions of lives and really brought the whole infection rate down, stabilized the economies of many of these countries, and improved the health in the world, including in the United States. And, you know, if we're just going to turn our back on that now at this point, you know, that was a an effort that was actually driven by in a big part by the mission churches, you know, religious orders, Catholic, Protestant, Jewish, Hindi, whatever, you know, that were taking care of these patients, and so many of them were dying. And it was that movement in the faith-based world that provides 25% of the care in Africa, by the way, that actually got PEPFAR, you know, approved in a gigantic bipartisan deal that has been one of the most successful public health efforts and overall foreign projects that the United States has ever done. I mean, people said it couldn't be done. I mean, everyone was skeptical, and it was done, and it was successful, and it's still successful. And now we're throwing that out the window. It's an incredible tragedy. Yes, again, I said it already today, but you can substitute other funders. You can figure out other ways to do this, but you're talking about a system that's so big that is going to take years to do. I would say 2 to 3 years before you could ever fill all those gaps. The U.S. just pulling out like that in one day is very cruel.
Mm-hmm. It could be very
Not what
catastrophic.
the American people are. American people are not cruel. I don't think they understand really what's going on out there. And
Mhm.
I'm here now. It's devastating.
Yeah. I mean, like you said, with HIV infections, the current drug courses and treatment plans have people taking a pill every single day. So if you're taking away the funding, if you're taking away the infrastructure to get people those drugs, it is an immediate harm that is being done to those people. So
It's
very, very unfortunate.
happening almost as we speak. They're running out of the stocks right now. This just happened, you know. So, you know, they're going to run out. And this is the tragedy that is going to be left in the wake.
Mhm. Yeah, absolutely tragic. And unfortunately, on that note, that is our time for today. So thank you so much, Dr. Murphy, for bringing us up to speed on everything that's going on, making sure that we are in the know and can share that information with the people around us as well. So thank you, and have a great weekend.
Yeah, you too. Thank you.
And thank you all for joining us for this week's episode of the Ask Dr. Murphy series. If you have any questions, comments, submitted topics, please leave them down below in the comments or at any of our social media linked in the description. We'll see you next week.